Elizabeth Johnson, and this is my research presentation. So over 75% of brain injuries is due to concussions, according to the Center of Disease Control and Prevention. Now, I will be discussing today how common concussions are and how important it is to know the information regarding concussions. But within my experience of concussions, within the past 8 years, I have received a total of 9 concussions, and due to that, it has led me to want to know more information so I can spread the awareness on concussions. Now, I will be discussing what exactly a concussion is, who it affects, and how to prevent it. So right now, let's go ahead and start with what exactly a concussion is. So a concussion is when someone experiences a traumatic brain injury to the head or a sudden violent movement of the head. For example, if you are sitting in a car, thankful to my brother, you have a seatbelt on, it is going to prevent you from hitting the dashboard and causing a concussion that way. Or, unfortunately, if you're walking down and then you have a sudden movement of the head, that is considered whiplash. Thank you. So, according to the Gale Encyclopedia of Neurological Disorders, a concussion is considered a milder form of a traumatic brain injury or a TBI. But what exactly, as well, a concussion is when the brain itself is caused to hit the side of your skull. Now, the types of symptoms related to a concussion would be either physical, mental, or emotional. Now, some physical forms of signs of concussions would be either losing consciousness, being sensitive to light and sound. Some mental causes and signs of concussions would be not being able to retain information or being unaware of the surroundings. And some emotional signs would be more irritable and more emotional. Now, let's talk about who exactly it affects. Now, who it affects depends on the age and the incident that caused the concussion itself. Now, between the ages of 15 to 30, the typical cause of concussions is either related to sports injuries or common day-to-day actions in your day. But in the adolescent, the most common sort of concussion would be a sports-related injury. And in the elderly, the most common form of concussion would be a fall. Due to how frail elderly can be, they're not as stable as someone in the younger years. Now, let us go ahead and talk about how to prevent and how to treat. Now, as some would say, if you have experienced more than 1 or 2 concussions, you might want to wrap your head in some bubble wrap, but in these cases, we're not able to do that. So based on the different types of concussion that you had received or the different instant will depend on what kind of treatment and what kind of prevention you want to do. So now, depending with options on the activities that you are active in will depend on what kind of prevention. For example, for softball, in my case, the best way to prevent a concussion for me would be to wear a metal infielder's mask that covers the entire part of your face and will prevent your face getting hit with a ball. Now, in other cases, such as cycling, and skateboarding, you will want to wear a helmet to protect and prevent a concussion if you were to hit your cranium. Now, worst case scenario, such as myself, I have received so many concussions, the best form of prevention for me and some athletes would be to stop the activity all in all. Such as myself, I had to stop softball due to my concussions. Now, to treat your concussions, like I said before, would be to depend on what caused your concussion. Now, if it was such as a non-severe case, you would want to just rest, relax, maybe take some over-the-counter medicine depending on what your doctor says. Now, that all depends on, like I said, what your doctor states. Now, in the more rare, severe cases that a concussion would cause a blood clot or a brain bleed, you would want to be supervised for a continuous period of time. Now, in conclusion to all of that, we have discussed what exactly a concussion is, who it exactly affects, and how to prevent it, and how important it is to make sure that you are aware of all of this information so you can protect yourself in any environment that you are in. So thank you so much for listening.